everyone. Thank you for joining. My name is Darren Jones. I'm one of the principals here at Baker Tilly, helping to lead our life science industry. Happy to be joined by my colleagues, Mark Scown, Kristen Godso. As we kind of revisit some of the industry forecast content that we talked about earlier this year in January when we did our well-attended industry forecast. We had a accompanying white paper that was published out on bakertilly.com that you can find. But we thought, just given the pace of changes that we've been experiencing in 2025, that it would make sense to kind of maybe just do a mid-year checkpoint, maybe a look back at things that are progressing as expected, as well as maybe giving some updates and some things that were unexpected or things that are rapidly evolving that require kind of an update to the conversation. I think, as you heard during the intro video, if you have questions throughout, we of course welcome questions and appreciate your feedback, and you can use that chat function there in the right side to submit any questions that you may have. So again, together with Mark and Kristen, we're going to touch on a couple of the things from the forecast, providing some useful information and updates. We're going to talk about specifically the overall kind of market assessment that we're looking at. Of course, some of Kristen's remarks on the capital markets and what we're seeing. Mark talking a little bit about some of the regulatory enforcement actions and changes that we've been seeing. But before we get into that, just wanted to maybe throw a polling question out. What are some of the factors that you all have seen that you believe is influencing the capital market industry trends in 2024? So GDP growth, labor market conditions, the results of the 2024 election, were all of the above. So you can go ahead and respond to that poll when you have a moment to. Well, let's start with that quick look back. Let's kind of start with that quick look back, looking at the regulatory landscape. There are some notable updates there, so looking forward to some of Mark's comments there, as well as with the capital markets, some updates. When we look at some of the drug pricing and gross to net complexities that we talked about in the 25 forecast, not much has evolved and changed there. We'll talk a little bit about, I would just say, the tone in Washington as it pertains to drug pricing, which is a little bit more sort of upstream challenges than some of the gross to net complexities that we talked about earlier in the year. The need for external funding requests. We'll kind of dig into that a little bit, especially as we talk about some of the impacts of the federal funding changes that are affecting the industry. We talk about the use of AI in the industry, so both on the drug development side, on the resource, on the evidence generation, real-world evidence front. I think much of that is playing out as anticipated. The complexities around HCP engagement and KOL evaluation also playing out kind of as expected. When we talked about enterprise risk management earlier in the year, some notable updates there, mostly pertaining to the change in the regulatory landscape, that environmental scan and how that plays into an ERM strategy. Some of the changes that we're seeing is definitely relevant, to how you would execute on an enterprise risk management program. So with that, just thinking about, kind of what we've seen thus far. I mentioned, before around some of the pricing considerations. I think the proposed most favored nation pricing, for the pharmaceutical industry, this is one area that has us pretty concerned. I would say very concerned in terms of how this can or could be carried out by the administration. When we think about how this really changes the entire, I would say, landscape and business model that the global pharmaceutical and medical device industry has followed for decades. Whether we believe it's appropriate or not, there's a level of innovation that is unique in the U.S. market. That focus on innovation and that intersection of innovation and capitalism, that is, I would call it, a uniquely American trait. And when we look at the impact of the most favored nation pricing, it threatens to upend some of that. And some of the detail of what is being discussed is implementing caps, on pharmaceutical drug pricing, limiting it to the lowest price paid by any of the OECD countries that have a GDP per capita at least 60% of the US's level. That is a significant price control. I think there's really two likely responses that many of us in industry will have to contend with should that come to pass. And that could involve kind of looking at how global pricing is managed and potentially looking at how prices can be raised in overseas markets as a way of limiting the price decreases in the U.S. market. I think that will obviously have profound effect, and not only with our market access negotiations, but also in terms of patient access potential implications. The idea of how the most favored nation model could force companies to restructure those pricing strategies. Price governance in general, I think, has been an area that we've seen industry kind of struggling with quite a bit. Just on the U.S. side, as we were dealing with price transparency over the past 5 years. But now to take some of those governance requirements and put them on a global scale to minimize or manage, the impact to U.S. pricing. I mean, it's a little bit about how we manage, government pricing in the U.S. on best price. I mean, it's really looking at that same kind of governance, but on obviously on a much more global scale and in an industry that is fairly decentralized in terms of the level of autonomy that many global GMs have. The global governance of pricing would be a very significant challenge for us to undertake and solve as an industry. The other point of strong consideration and conversation of late, has been around tariffs. And when we think about, the potential impact of pharmaceutical tariffs, I mean, there's been talk of the tariffs going as high as 245% when we start talking about active pharmaceutical ingredients coming out of China specifically. And that 245 includes some of the reciprocal impact of the tariffs, that passed on the Chinese side of the trade equation. And I think all of this increased rhetoric, I think, really has the whole industry concerned in terms of, again, not how do we calculate a tariff. The calculation of a tariff is a pretty straightforward mathematical exercise. It's more a question of what business practices are going to change. I mean, our customers are being squeezed in the healthcare provider arena. They are being squeezed, as we're going to talk about in a moment, with the NIH funding. We've got a potential top line revenue squeeze coming from the most favored nation, and then we've got the added expense of tariffs and all of that. All of those things, obviously, individually, could have a material impact on overall, product profitability, and you put all of those together, and the net impact, could be very significant for our industry. As I talk about the impact to our customers and the overall healthcare ecosystem, the impact to NIH. I mean, in a lot of respects, NIH has been really decimated in this current administration. Over 2,200 grants, have been canceled through the first 6 months of the year. And that totals over $3.8 billion in direct NIH funding to research activities that have been eliminated in these first 6 months. In addition to the funding, being slashed, we've also seen reform around how overhead is allocated. For ages, it was common to see 30 to 70% indirect cost overhead allocations on research budgets, but now those overhead charges are being capped or limited to 15%. So this combination of canceled grants, eliminated funding, and that fundamental change to how overhead can be charged, both of those things have added up to really creating more financial distress on many of our research partners in the academic arena. I'm sure we all read the news, but the focus, of a lot of these cuts have been academic research hospitals. More than half of the funding that's been cut off by NIH has been the funding that's been going to research hospitals for programs, that really span a number of critical research categories. So we're talking about a lot of oncology research, infectious disease research, mental health research, just to name a few in terms of areas that have been most profoundly impacted, by the slashing of NIH funding. Beyond those areas, I mean, it's important to highlight, when we look at, the Foreign Corrupt Practices Act, and Mark will get a little bit more into this later on in the conversation, but the government has suspended enforcement of the FCPA, believing that it's hard to predict, kind of how that's going to impact the industry. But I would say the attitude of the administration in that is that in many ways they viewed the FCPA as making U.S. companies anti-competitive. And we've already seen, a number of companies trying to unwind or understand, what the impact, of that FCPA suspension is. Obviously, there's a 7-year look back. So how much is this actually going to change we're not sure of. But certainly when you take all of these things together, it's clear that the government's, I would just say, attitude towards the industry is not necessarily one of collaboration, right? I think the attitude is that this industry is one that needs to be reined in. And we're seeing, again, so far a lot of talks of executive orders and other discussion about reining in the industry. But as some of these items that we've talked about sort of come to pass or come to some level of finalization, over the remaining 6 months of the year, could absolutely change many of the dynamics that kind of underpin our industry for probably quite some time, into the future. What I'd like to do is talk a little bit, as we talk about some of the government impacts on our industry. I want to get Kristen, pull you into the conversation, talking a little bit about some of the changes that we're seeing, on the capital market side. Specifically, maybe what direction, do we see the life sciences industry overall moving, so far this year? And what are some of the changes that are being made in the capital markets that support our industry?
Yeah, thank you very much, Darren, and happy to be here with everybody today. I hope everyone, if you're joining us live, are managing to stay cool today. It's currently about 100 degrees in Boston, which is not normal. With the capital markets, with all of the challenges that Darren was sharing, we're really seeing companies currently navigating a tremendous amount of uncertainty, impacting everything from funding and IPOs to M&A activity, as well as the regulatory landscapes. Companies are being forced to rethink supply chains, regional dependencies, and operational models. And these potential tariffs that Darren mentioned on raw materials, lab equipment, and APIs are forcing reevaluation of sourcing strategies, supply chain, and regional dependencies for the industry. So it's having a tremendous impact. Many things for companies to be thinking about. In my discussions with my clients and with CEOs, it's really a juggling act with everything going on at the moment. In terms of digital transformation, this is something that we're seeing a lot of in the industry, and not just as a tech upgrade, but really as a strategic realignment across R&D, clinical manufacturing, and the commercial functions. Oftentimes we see life science companies implementing these tech tools without addressing the root cause and deficiencies in the processes that they're meant to support. So it's really important to focus there. And a common area with, a lot of my client base is managing the CRO process and tracking significant amounts of data between the ClinOps and finance functions to ensure timely and accurate financial reporting. So putting these technology tools in place and embedding the technology and real-time collaboration in every step is important, including involvement of regulatory and compliance in those steps. Biotech companies were, increasingly recognizing the value of data analytics as well for improving R&D, clinical trials, and overall business strategies. So these are all ways that we're currently seeing amongst our client base companies focusing on that digital transformation. Additionally, compliance, it's not a competitive differentiator anymore. It's really what sets companies apart is their ability to be agile in the current environment. Successful companies are integrating regulatory compliance into the product life cycle early and building their agility via intelligent and these tech tools that I mentioned. So really here, the key takeaway is, the industry must move from siloed, compliance-driven structures to agile integrated systems that involve both compliance early in the process as well as product lifecycle to remain competitive.
Maybe one thing, Chris, that I would just highlight, one of the things that has not changed, right? We as an industry have always taken advantage of, for example, the R&D, tax credit, structures that have been established for a long time have been very beneficial. I guess it's important to note that is not an area that's been looked at. If anything, if we're to see kind of an area for opportunity, there's been some talk about potentially expanding, access to those credits, the value of those credits. So, as we talk about many of these changes that are happening, in the markets and some of the things that drive valuation, I think it's important to highlight that what's not changing.
Yeah, very good point, Darren. Appreciate that. So moving on to investment trends. So I'm located here in the Boston area in New England, and we're just coming out of last week's Bio International conference. Lots of discussion around, investment trends and, again, what's happening in the capital markets. We're really, there's still that optimism, but things have for a lot of our early stage startup companies have gone on hold with some of these things because of all of the challenges that we've talked about. So it's a mixed bag. In terms of what investors are looking for, they're being much more selective in terms of their investments. Investors are rewarding strong science, clear commercial strategies, and of course, solid business fundamentals. For each of the categories here on the slide where we're talking about what we're seeing as, over the last 6 months where investments are focused for each. So as it relates to angel investments, we're seeing trends with AI-driven drug discovery, digital therapeutics, and diagnostics. And as I said, investors being much more selective and expecting a clear regulatory pathway and robust preclinical data before committing to those investments. In terms of VC, arguably this is the lifeblood of our early stage biotechs. We're definitely seeing a rapid retreat with early stage deal values hitting a 4-year low. There's rising global competition because of the current challenges in the US. Asia is now currently leading in biotech patent filings and IPOs, thanks in large parts to China. So this is leading to concern that innovation here may be shifting abroad if US policy fails to respond. For 2025 trends thus far, fewer but larger deals we're seeing in the VC space. And again, more selectivity by investors. On the PE front, we're seeing private equity focusing their efforts towards companies with established revenue streams, proven technologies, and clear paths to profitability. We're also seeing, I have a number of clients with PE transactions in the CRO space, so we're seeing investments there as well. Definitely more thorough due diligence being conducted around those regulatory risks from the PE firms. And target companies that they're looking for tend to have strong management teams and a diverse customer base. And lastly, as it relates to M&A and IPO, given the challenges we've seen with companies accessing public markets, we're seeing more M&A activity as companies seek to combine resources and expertise to advance new therapies. From what we talked about back in January with the kickoff for the industry, the biotech IPO market has not rebounded as we had expected it to, with fewer companies going public, and those that do are those later stage companies with more established financial backing. So what we're seeing here is, companies really need to be agile due to these realities. A lot of companies we're seeing take dual or even triple track paths where they're planning for, potential IPO, sale, or private financing. So they're running those tracks concurrently. It can definitely be challenging, but companies want to be ready when the markets do shift. So really that focus around readiness in terms of, if they are thinking about IPO in the future, enhancing those financial reporting capabilities and involving the right consultants and experts early on. Extremely important to be ready when the markets shift and those opportunities arise, whether it be an IPO or sale. So overall takeaway, companies should continue to focus on what they do best and collaborating with others to leverage those complementary strengths.
I mean, Kristen, you were highlighting the need to be agile, right? And maybe on some of the early stage companies, right? The importance of having a viable commercial model, and certainly as we see the innovation in diagnostics, the innovations in digital health, creating those commercial models has always been complex. How we ensure effective and fair coverage for some of those solutions and some of those capabilities, especially if it's a diagnostic or, something that helps precision medicine, helps direct, the therapeutic treatments, but does not sort of represent the therapeutic treatment in and of itself. We're seeing a lot of those kinds of innovations, right, that make other existing therapies more effective. But reimbursement and the commercial model for those, is extremely complex. And as we talk about the tenor in Washington, I think it makes the risk, right? And I think what we're seeing is some hesitancy from the investment community, because now it's, the risk of making those investments and the risk of actually being able to put together a viable commercial plan that can drive top line growth and not sort of run into CMS coverage decisions that are kind of adverse decisions or coverage decisions or being forced to a price point that no longer makes it profitable. I mean, these are very real challenges that some of these companies are facing, and investors are much more wise to that, right, and much more sensitive to that. And I think we're seeing some of that play out. And certainly even the more established companies, I think, still, have aspects of their commercial execution, that they're still kind of struggling with. And maybe that's a point I could kind of, transition with you, Mark, is, as we're seeing, talking about a little bit about the enforcement trends, right? What's new, and from what's new, what's actually not new information, but needs to be reinforced yet again, within our industry.
Sorry, I think I was on mute there. Thanks, Darren. All good information I'm looking to cover in my section, but just to kind of start here, brief introduction, as Darren had introduced us at the beginning. I'm Mark Scallon, a principal also at Baker Tilly in this life sciences consulting practice, and I focus in particular on the compliance and ethics environment of the life sciences industry. And so with this recent enforcement action section of today's webinar, what we want to do is really highlight a few of the things that have come up since our last industry forecast back in January, namely go through sort of the facts associated with a recent settlement from a few months ago. Also updated guidance to the Foreign Corrupt Practices Act, which Darren alluded to a little earlier. And then also one area in particular of focus that we're seeing in the industry as increasing and becoming particularly more important, and that's in the whole stewardship or external funding request area for the industry, which we're seeing as a bit of a reaction, or the increased volume associated with those activities as a reaction to some of the actions by the current administration, which again, Darren mentioned earlier. So kind of get into it here first with the recent settlement, right? So if you all had been reading the news, back in April, there was a $202 million settlement related to kickback allegations of a large biotech company. And it's information that we sort of heard before, right? It was a kickback allegations associated with speaker programs, which is, obviously something that the Department of Justice has been very open about saying they are going to actively look at, and they have been for years. And so some of the facts associated with the settlement, or I guess I should say allegations associated with this settlement are things like, alleged kickbacks through granting speaker engagements for high prescribers in particular of the company's products. So paying them honoraria to be speakers at speaker programs, essentially. And then the other accusation was that the venues where these speaker programs were being held, and as a lot of you know, speaker programs are typically held over dinner in a restaurant. The settlement alleges that those venues or those restaurants were they considered to be luxury, and that there was exorbitant meals, alcohol, and payment for travel associated with those events and activities. And then interestingly, something that we're seeing a lot more of going back to a settlement that was 5 years ago, which I'll get to in a second, was repeatedly inviting healthcare professionals to either speak and or attend the same programs in a very short period of time. So essentially the programs are on the same topic, exact same slide deck, exact same material. Is there any, which raises the question of, is there any educational value associated with the same physician or healthcare professional going to multiple programs around the same thing? So a few things I wanted to note related to the settlement that kind of caught my eye. One was, if you read it, the Department of Justice's letter associated, or memo associated with the settlement, they did call out that the company developed its own slide decks to be used by the speakers at the speaker program. Now, all of us who work in the industry, particularly those of us who work in compliance and ethics, know that that's a common tactic and control to ensure that the speaker doesn't go off script, or go off topic, or communicate off-label information, or communicate misinformation related to the product. And so in an effort to be more compliant, companies are actually being cited for doing something with a negative connotation related to that best of intentions, right? Which I bring up just because it really highlights sort of the challenge that life sciences companies face, and that the compliance function that these life science companies face, because you're sort of damned if you do, damned if you don't, if you will, or for lack of a better term, right? You're trying to protect the organization, and by not going and proactively communicating off-label information, by putting controls around a slide deck, but then you get called out on it saying that, well, you're controlling what the doctor is saying, therefore it's really more commercial intent as opposed to educational intent. So just wanted to note that, and something that you should all be aware of. I'm not suggesting that you should stop developing the content and the slide decks for the speakers for speaker programs, but do note that the Department of Justice is noting it in these settlements. The other note related to this settlement that I thought was interesting, I don't think I've seen before in previous settlements, but the Department of Justice actually named or listed the restaurants that the company used for these speaker programs that they deemed luxurious. So I would suggest, if you haven't read the settlement, to maybe go and read that list of restaurants that they cited as being luxurious or exorbitant, and maybe flag them and strike them from your restaurant list of where you may be holding speaker programs, because clearly those restaurants and those types of restaurants are something that in the DOJ's eyes could be a smoking gun. One restaurant in particular, and I'm just going to name one here, and then if it sounds familiar to you, then immediately go and remove that from your Speakers Bureau destination. But was the James Beard House in New York City. They mentioned that the company had 157 speaker programs at the James Beard House, and at the James Beard House, it's a 6-course meal with alcohol pairings and things like that. The time frame was before the OIG special fraud alert around prohibiting alcohol at these programs, so that's sort of irrelevant. But they're citing the fact that it was 6-course meals with pairings and all of that as the reason for the James Beard House being an exorbitant location. So just something that you all should note there related to that settlement.
Maybe one thing I'd point out there, Mark, I mean, I think the main control, right, that most organizations have on this is their meal limits, right? But if you do, how many did they say, 156 programs?
157, yeah.
Let's be clear, some of these restaurants will negotiate, right, when there's a large volume of private events coming in. So just having that limiter doesn't necessarily prevent the kind of things that we're seeing highlighted in that sense.
Yep. And just to draw a parallel, as I mentioned earlier, to something from 5 years ago, I mean, we've seen this before, right? If you look at the sort of the allegations of this most recent settlement 2 months ago to the one 5 years ago, and everyone knows this one, so I'll just name it. That was the big Novartis settlement of $678 million in kickback allegations in July of 2020. It almost reads like a copy paste, right? It was, luxurious venues. It was targeting high prescribers as speakers for honoraria. And note that last bullet there, repeatedly inviting the same ACPs to attend the same programs covering the same topics. So despite what you feel around the actual intent of speaker programs, whether they are truly meant to be educational, whether they're meant to be more commercial under the guise of education, regardless of your own personal feelings around it or your company's take on it, it is clear that the Department of Justice under this administration is not pausing on enforcement in some areas that we've seen in the past. It's the past repeating itself, and it's going to continue to repeat itself. One way to mitigate this risk is through data analytics. And if any of the compliance and ethics folks on this webinar right now were at the Pharmaceutical Compliance Conference a few months ago, or the PCC in Tysons, Virginia, the conference chair was Neil Falkenham, who's the senior VP and chief compliance officer of GSK. And at the conference, and at the very, in his opening remarks, The second thing he said, I believe, after introducing himself was, and I'm paraphrasing here, so this isn't a direct quote, but if you aren't using data analytics for your compliance program now, and using it for your auditing and monitoring function, then you are already behind. I think this has been a topic over the last few years where data analytics to inform your compliance function has always been a nice to have. It's now based on the DOJ's recent updates to guidelines on an effective compliance program, as well as the OIG. It's truly become not as much of a nice to have anymore when you have enough budget to pay for it, but now more of a must have because it can prevent things like this. You can use that data analytics to identify if you are inadvertently using the same HCPs to attend the same programs on the same topic over and over again. You can use it to enforce your meal limits, like Darren was talking about earlier. Having data analytics takes human error out of it. It makes all the information clear. You can put it in a dashboard, so you can just come to your computer in the morning and click on the dashboard and see what has happened over the previous day or the previous week on some of these activities and the analytics associated with it. So I would urge you all to, if you haven't already, make sure you use data analytics as a risk mitigation measure for these types of things. Okay, enough on that settlement. So on to the next second topic I had mentioned was some update from the Department of Justice related to the FCPA. So if you all remember back in February of 2025, there was an executive order from the Trump administration directing the Department of Justice to align FCPA enforcement with a broader national interest, basically saying that we're not going to be enforcing the Foreign Corrupt Practices Act for the time being, or there would be a 180-day pause associated with it. And so on earlier this month, I believe it was June 2nd, the Department of Justice did come out with, they released their FCPA enforcement guidelines. So this was after a 4-month pause in prosecutions, and the updates reflect really a strategic shift in enforcement priorities of the DOJ as it relates to the FCPA. And really, the updates are really aiming to limit that undue burden on U.S. companies that are operating abroad and target. So basically, this was saying that they're not going to stop enforcement, that their enforcement, though, is going to be very targeted, and it's going to target things and conduct that directly undermines the national interests of the United States. So it reflects no focus on misconduct involving routine business practices or low-dollar business courtesies. One can interpret that as small dollar bribes if one were thinking in the context of the FCPA. But that is sort of the language they're using here is they're not going to be looking at things that are just normal business practice in those countries as a violation of the FCPA. Rather, we're going to look at things that would affect national security, the ability for the U.S. to be competitive globally, and also we're going to focus on transnational cartels and systemic corruption by companies other than maybe U.S.-based companies. So this was good because it kind of, it was very, very vague back in February, saying that there was going to be a pause on all enforcement actions related to the FCPA. It provided a little more clarity, but it also provides risk from a compliance and ethics standpoint, right? Because this may lead some U.S.-based companies to believe that there is less risk in ex-U.S. operations, and that it could just be a Wild West environment outside of the U.S. around business conduct, and that corruption and bribes are now acceptable. One should note that the statute of limitations is 5 years on this, on any actions that you take. And so things that you do today during this administration could be held against you after this administration. So while part of these enforcement guidelines say that they're also going to look at individuals and who may be doing actions that violate the FCPA instead of companies, know that all could go away in a few years when there is a administration, when we transition to a new administration after this administration. So at that same conference I mentioned, at that PCC conference a few months ago, a lot of people were talking about this, and the general consensus was stay the course. Everything that you've been doing around FCPA compliance, you need to stay with it, because you still, at administration change, you could still be liable for anything that you're doing today. And the legal and compliance functions, like the whole company is going to be looking at legal and compliance to really provide guidance on this. So just make sure that you are still, that you have taken a position on this and how you're going to treat business conduct outside of the United States, and make sure that you're being communicative to your teams and to the organization about how they should be conducting themselves despite the executive order and these guidelines. And also remind them that there's other anti-corruption, anti-bribery, and kickback-related laws all around the world that goes beyond, the FCPA. So you're still liable for those laws as well, like the UK Bribery Act, the Clean Companies Act in Brazil, Sapandeux in France. I mean, there's a bunch of them. So anyways, so just wanted to provide that update. How much time do we have left? Okay, I think we're doing okay. I have one more thing I just wanted to go over, and that's around what we're seeing as an increased trend from our clients related to requests for us to help them with designing workflows, implementing technology, and managed service around things related to stewardship. So what is stewardship? Stewardship is sort of a new word that refers to what has traditionally been known as external funding requests. And so there are 4 types of external funding requests. Excuse me. There are investigator-initiated studies, charitable giving and charitable donations, medical education grants, and sponsorships. And why are we seeing an increased volume of not just project requests from our clients related to this area, but we're just seeing at our clients an increased volume for each of these types of funding? Why are we seeing that, and why should it be on everyone's radar? It's really related to 3 main things, right? One, funding request organizations are really now looking to the industry to fill that gap in the funding that they used to be getting from the federal government. So at the very beginning of this, right, Darren was talking a lot about with this administration, a lot of funding's been taken away of the NIH and the trickle-down funding from the NIH into the research hospitals and other clinical organizations. That gap has to be filled somewhere. And we believe, and we're seeing, like I said, at our clients, that gap is being filled through stewardship. And so that's one of the reasons why it needs to be on everyone's radar. 2, by doing so, it really enhances stakeholder trust and strengthens corporate reputation. It enhances the industry's visibility as stewards in life sciences. And with that increase, and the reason, and part of why it also needs to be on everyone's radar is because with this increased volume, there's also increased risk, right? So every company needs to, now more than ever, need to have processes that are more streamlined and controls that are more tightened up to ensure that as you're doing more of these types of external funding, that you're doing it the correct way. Now, when we go in and do an assessment of one of our clients' external funding programs, the biggest risk we see when we go in there is that there isn't a clear delineation of definitions between the 4. And there are unique risks associated with each of these 4, and there are unique controls to mitigate the risks associated with each of these 4. And so if someone has a request for a charitable donation, but then they go down the medical education grant process, you could inadvertently be violating certain regulations and things that the specific controls were intending to prevent. So that's just one example of why you need to have this more tightened up as these volumes increase. And so lastly, the impact of these stewardship efforts, right? The impact that the increase of these external funding requests are going to have on the industry. One, what we're seeing is that it's going to channel billions of dollars into the healthcare ecosystem. It's going to make a substantial impact on research funding, healthcare accessibility, and scientific advancement. Third, it's going to strengthen corporate reputation. Four, it's going to enhance stakeholder trust, as I mentioned earlier. And then the last two is that it's going to demonstrate commitment to ethical and impactful healthcare advancement and shift perceptions and foster greater appreciation for the industry's role in driving medical innovation and improving global health outcomes. So everything is pointing towards us really this what we're already seeing as an increased trend in this area, just continuing to increase, particularly through the administration, while they continue to decrease funding of the NIH. So,
I mean, it's really, Mark, it's an opportunity for the industry to kind of lean in, right? And I think be more proactive. I think, again, stewardship in this industry has been around for forever. It's been around in pockets. I think as an industry, we are sometimes a little shy about sort of taking credit for our contributions to the overall healthcare ecosystem. And I think this is a time not to do that. I think this is a time for us to highlight, how we support the broader healthcare system. I mean, part of the reason why, many of these actions in Washington are getting so much traction, right, is because of the perceived mistrust of the global pharmaceutical industry, which has been plaguing us for at least the last 20 years, 25 years that I've been in the industry, right? I mean, it's the oil and gas industry, the federal government, and the pharmaceutical industry, right? Those are always the three bottom in the Gallup poll on the most trusted American industries. And even post-COVID, we never really saw the bump in the trust of the industry. And now we're seeing all of these, I would just call them kind of draconian regulations or draconian changes that are being proposed that have the risk of completely upsetting our global business model. And so this is not a time for us to sort of sit back and be passive when it comes to our role as stewards of healthcare. And it really would behoove the industry right now to be fairly aggressive in terms of how we lean into this. And I think, Mark, as you indicated, I think sometimes companies get very stuck, in their structures around stewardship. And while I think the structures and the controls and the governance are absolutely critical, we also need to recognize there's room for planned and unplanned giving inside of a mature stewardship program, right? And I think a lot of organizations get a little tripped up on the solicited versus unsolicited, elements of a grant or a contribution, right? Rather than focusing on sort of planned or budgeted and unplanned and unbudgeted, right? Because for me, those are two different things, and there's controls that can be put in place around planned stewardship activities that still alleviate the risk that's present in, the solicited or unsolicited debate, which I think in the compliance world, we're trying to put that to rest a little bit. But I know it was a great discussion, from you, Mark, and as well as you, Kristen. I mean, lots of changes, a lot of evolution, inside of our industry. Kristen, your comments about, being agile, right? That resonates through everything that we've been talking about. The fact that ability to be agile and that ability to have a sound commercial plan that is, I would just say, reflective of the current regulatory environment. I mean, that is something that clearly investors have become very sensitive to. And just given the speed with which changes come out of Washington, the reality is, that is a must-have, not a nice-to-have. When we're looking at how companies are looking to raise capital. Mark, if I could summarize some of your key points in the compliance conversation. We, as an industry, we still need to sort of sometimes get out of our own way in terms of, how we execute on our commercial strategy, right? Bona fide education, product education, nobody will ever say that there's not a place for that. And certainly as our products get more complex and the use cases for the products become more complex and the diseases that we're treating become more rare, the need for true disease awareness education and product training is going to become much more profound. And I think for us as an industry, we need to make sure that we are anticipating what those educational needs of our products are going to be, to make sure that we're feeding those educational needs. Those need to be fed from medical. They need to be fed from real world evidence and real world data. You go back to that Novartis settlement, like you highlighted, Mark, the big concern that was raised in that settlement and multiple others is, as you said, it's the same content. We're 3 years, 4 years post PDUFA, and we're still educating the market or educating the physicians on the same base clinical data. And that is what's really drawing the ire of the DOJ, right? After 4 years, if you don't have any new data, you don't have any new information, then they believe that these meals are nothing but a lavish reward for prescribing behaviors. So it's ironic, and given the nature of our industry, but the answer to this is constant innovation, constant data collection, constantly measuring and evaluating, real world data and outcomes, of our disease, as well as the comorbidities that patients with our particular disease also suffer from, and building that kind of educational content into our programs to make sure that we're fresh. And I would also just highlight that goes along with the stewardship message that we need to be much more proactive in, right? In terms of our role in educating on disease, our role in supporting the research of diseases, our role in advancing contributions to advocacy organizations that are representing, underserved patient classes. These are all things that we do routinely as an industry, but really need to be rebranded, rebadged, re-emphasized, however you want to phrase it, with this role of the life science industry as healthcare stewards in a global healthcare system that is in some ways sort of coming under attack in a lot of respects. So thank you all for joining. Appreciate you taking the time this morning or this afternoon to join us for this conversation. Look forward to sharing more of our insights with you as the year progresses. So thank you so much.
Thanks, everyone.
Thanks all.